My father was diagnosed with liver cancer, and his doctor gave him 6 months at the most to live.
Liver cancer 10 years ago was a death sentence. There was really no options available. Over the last 10 years, we realized that by going into the blood vessel that feeds the tumor, we're able to control the tumor.
Piedmont Radiology stepped in, and we were told about the chemoembolizations, and we started it the very next day.
Now we provide TACE, which stands for Transarterial Chemoembolization, and predominantly means that we go in with a catheter, target the area as selectively as we can, and introduce particles that have chemotherapy on them that treats that tumor. And we have found that to be extraordinarily successful in prolonging life in those individuals who may have what's known as a hepatocellular carcinoma.
By delivering very high doses of that chemotherapy drug directly into the tumor in this bead, we are able to not only cut off blood flow to the tumor, and tumors need blood flow to survive, but we also administer a second punch to that tumor by giving chemotherapy, which kills those cells that make it after their blood flow is cut off.
It sounded so simple that I knew that it couldn't have been that simple. But once I saw the progress of the first embolization that he had, I could not wait for the next, because each one brought a renewed hope for all of us. And in 4 treatments, he was cancer-free.
Because of the new materials that we have to treat these tumors, as well as the tools we have to deliver that treatment to the tumors in a much more selective way, we can not only increase the effectiveness of that treatment, but also reduce the toxicity, the side effects that has reduced people's feeling bad and has directly reduced the amount of hospitalization necessary for these treatments.
Procedure-wise, I mean, there's not enough good things I can say about it, because I've always heard of the terrible side effects of having chemo, and there's no hair loss in this case, at least with me, and the after results have not been that severe. Of course, you get a little stomach cramp and some things. I mean, it's not a totally uneventful thing, but as all pretty much it is. So I'm totally satisfied with it, and I've got nothing but good things to say about it.
The risks of complications after the procedure are slightly greater in general in patients who have chemoembolization than for radioembolization. We generally call those complications post-embolization syndrome. Typically, post-embolization syndrome involves fever, nausea, feeling tired, losing appetite, and abdominal distension. Typically, this is worse in patients who have chemoembolization than for radioembolization. But in a lot of patients these days, with the newer techniques with chemoembolization, these risks are dramatically reduced compared to the risks that we used to associate with these procedures.